Good afternoon. My name is Katrina Pavlik with USF Health. We're here on a virtual Facebook Live with Dr. Henry Rodriguez, who's the director of our Diabetes Center at USF Health. Thanks so much for being here with us.
It's a pleasure to be here.
Yes.
I'm sorry, a pleasure virtually, I guess, right?
Yes, we're practicing our social distancing. We're going to get really good at this by the end of this. So yeah, you play a super critical role right now during the pandemic. The CDC has determined that people living with diabetes are at a higher risk and of getting sick. Since it's a comorbidity. What guidance do you have for diabetic patients right now?
Yeah, I think, certainly, yes, the CDC has identified diabetes as a major risk factor. Really, the message I think that needs to go out is that, for patients with diabetes who are managing their diabetes well, their risk for actually contracting the disease isn't any greater. High blood sugars can affect the immune system and dampen, let's use that terminology, dampen the response to an infection. But if their blood sugars are in a near normal range, that really shouldn't come into play. The issue really becomes if they get infected. It's the underlying reason that we recommend that all of our diabetes patients get the flu shot. You know, Having the flu, it's pretty miserable if you don't have diabetes. If you do have diabetes, then your blood sugars become more difficult to control, and then that will affect, how you handle the infection. Really, the message that we're trying to convey, honestly, is to manage your diabetes well. First of all, so that, again, you're not dealing with illness in general. And one thing that I can't stress enough is that the last place we want any of our diabetes patients in is urgent care or the emergency room. Because we all know that those areas right now are being frequented by people that feel ill, obviously. And so, we really want to avoid that exposure if we possibly can.
Well, that's fantastic advice. Really appreciate that insight. A lot of diabetic patients are on insulin and it can be financially challenging. If a patient is, having difficulty with, being able to obtain their insulin, there's a few different resources that the American Diabetes Association recommends. One is insulinhelp.org. Do you have any additional websites that diabetic patients can turn to for resources or ways to kind of help manage those expenses?
Yeah, so there certainly are other resources online that at least they can point them in the right direction. I think the first place that they should go is speak to their provider, because their provider may have some samples that can tide them over. I think there is a thing out there, and perhaps you and I discussed this perhaps earlier, the issue of people rationing their insulin so they don't run out. I can assure you that the manufacturers have said that there's not been a rush on, thankfully, insulin like there's been on toilet paper. It's not like their pharmacy is going to run out of insulin. We want people to limit their trips outside of home, but as long as they have their normal supply of insulin, it shouldn't be a problem. If it's a financial issue, I would say first contact your provider. We encourage our patients to contact us. Our clinical social worker can identify potential resources. We can give them samples. I mean, there are workarounds. We do not want patients stopping their medication. You stop your medication, it's more likely you're going to feel ill. The more likely you're going to feel ill, you're going to end up, again, in urgent care or the emergency room, and that's the last place you want to be unless you absolutely have to be.
Well, thank you so much. I'm really glad that you brought up the rationing of insulin. What are the risks associated if you end up, doing such a thing?
Well, as I mentioned, higher blood sugars. And so, obviously there are patients, I should mention, that, are not using insulin, but they're on other medications that they use to help manage diabetes. Same holds true there. We want individuals to manage their diabetes well, as I mentioned. And so, if their blood sugars are higher, their immune system isn't going to function as well. They're more likely to become ill if they become exposed to COVID-19. And then again, it's going to place them in a scenario where potentially they're in an urgent care or emergency room setting where there's a higher likelihood that they're going to be exposed to somebody that may have COVID-19. They may have something else as well. We always tell people that, it's not currently, but generally it's nice to visit people in the hospital. You don't want to be there as a patient if you can avoid it in any way.
Well, thank you so much for that. And with a lot of us staying home 24/7 right now, it's been a struggle, some cabin fever going on. But with us being home 24/7, it's sometimes challenging to motivate yourself to be nutritionally smart and maybe exercise. Do you have any advice for patients in general and especially diabetic patients since that's so important?
So I think in terms of the cabin fever, um, yeah, that's a challenge. I can tell you that many of the people I know, particularly folks in our neighborhood, if you have the ability to get out early, take a walk around the neighborhood. Take in the sights. Maybe if you're busy going to work every day, you don't necessarily have the opportunity to do that. But you want to, again, social distancing. You want to avoid crowded places, but I think that's certainly will help in terms of your blood sugar control, will also help in terms of your sense of well-being. Um, I think in terms of insulin and medication doses, if on average you tend to be more active and now you're less active at home, you may need to adjust your doses. Also, something that I think I am guilty of, and probably other individuals, when we're home, we tend to snack more. So really, if when you do go out for that grocery trip, try to avoid, buying those foods that are tempting that perhaps you shouldn't overindulge. Really trying to avoid them, limit those temptations, and really, try and stay the course, and reach out to others in your own nuclear family at home if they're at home, to try and help support you.
That's great advice. And it's a lot easier if you're not tempted by what's in your pantry if it's not there. So, really appreciate that. Actor Anthony Anderson, who's one of the leads on Blackish, which is a TV show, has been very vocal on social media regarding type 2 diabetes. His character in the show has it. In addition, he personally has it. So, they're dedicating the episode regarding that. And one of the hashtags he has is Get Real with Diabetes. And GetRealWithDiabetes.com is another resource. What are your thoughts on that? I think it's so important that we have people that work in Hollywood kind of supporting common everyday conditions that patients have. So what are your thoughts as far as resources and different options
Yeah,
available?
I think that's great. Increasing public awareness regarding diabetes and not stigmatizing it, I think is really important. There has been, and I forget the name of a trade group that has been in place that really has advised, script writers and producers and so forth, and served as a resource when they're developing a storyline. Obviously, we'd like people to, if they're going to, well, it's great if they highlight diabetes, but obviously in an accurate light. It's not doom and gloom. It's definitely manageable, and it affects people of all walks of life. And so I think that messaging is really important. The American Diabetes Association, as you mentioned, is a great resource. The Juvenile Diabetes Research Foundation, there's Children with Diabetes, and organizations like that have some very valuable information. I should mention before we finish up that the American Diabetes Association does have a specific website landing page that specifically addresses COVID-19, and maybe you can send this out later, but it's diabetes.org/coronavirus COVID-19. And it's actually, it's a wonderful resource because not only do they have educational information. For example, they've got a form letter for adults that have diabetes that want accommodations, not being at I guess the front register at your fast food restaurant, being able to limit their exposure and so forth. And so those kinds of resources, I think, are very practical, everyday, valuable things that you might not find elsewhere.
Well, thank you. That's fantastic information and really good resources to keep in mind for patients. So, you're the director of the USF Diabetes Center. What has the Diabetes Center done as far as changing to better serve the patients that you take care of in the center for this pandemic?
Yeah, I think this is going to sound somewhat boastful, but I am very privileged to have an awesome team. We decided early on that we wanted to limit exposure to our patients. Whether our patients are seen at the Morsani Center or they're seen at the Brandon Healthplex, we made the decision that, hey, there are other providers in the building that may be seeing ill patients, understandably, and we wanted to limit exposure. So within a week, we transformed, which was a practice that was 99.9% in person to telehealth. And so basically we pulled our research personnel, anybody that looked like they might be unoccupied in any way, and got them online, got them to phone patients, making sure that they had the appropriate app on their phone or access on their computer that would allow us to do telehealth visits. One thing that I've always stressed to my patients, and this has been for 10 years plus, every time I see them, I really stress the fact that they should be uploading, whether it be their meter or their pump or their continuous glucose monitor, and reviewing their data. And it's been somewhat humbling to me, and not necessarily in a good way, because it's become abundantly clear that a large number of our patients don't do that. And we upload their devices when they come in for their visit, which may be every 3 months. The quality of the care that we can provide via telehealth is immensely superior if we're able to review their data. And so what I've typically done is, there's Dexcom Clarity. There are platforms that will gather their data from their devices. I will share my screen. I'll open up their reports and walk them through it. And with the exception of the physical exam, I think we're providing the same level, if not maybe even a little better, to our patients. And the other thing that this telehealth process, as painful as it has been to kind of fast forward all of it, it's actually provided us a little bit more of an intimate opportunity to talk to our patients. They're at home, they're comfortable. I talked to a patient earlier this week. They were out by their pool, the cat was there, and it's really, I think they feel more comfortable, and that's great. But again, it's this issue of our team reaching out, stepping up to volunteer to help patients get, connected and to make this all, happen. And so I'm very proud of that.
That's fantastic. I understand USF Health as a whole has adapted telehealth. So it's wonderful that your center was kind of the pilot and really led the charge on that. It really is beneficial for patients as far as care. So I'm so fortunate that you're doing that for our patients. Another question that I had, you as a healthcare provider, you're working on the front lines with patients. I know it's not always easy and there's not always a great answer for this, but what advice do you have for other healthcare providers out there right now that are maybe working in the hospitals or just working in their clinics trying to manage patients? It's stressful ourselves personally. So how do you handle that being a provider?
It can be difficult. And, I can tell you, as someone who doesn't have to work in the emergency room or the intensive care unit, I have the luxury, so to speak, to be, interacting with patients. I've gone into the office, but I'm in my office and I'm working on my computer and I'm interacting with patients that way. As I said, all of our routine visits are now telehealth, but we are seeing some patients in person if that is, if that's required. But, it's really a realization that, even though we don't know how long this is going to last, it's temporary. There are some silver linings to all of this. I think people are spending more quality time maybe at home. I think, as far as stress release, trying to get out, as I mentioned, even for, we should practice what we preach. Get out there early in the morning, take a walk. Your pet might appreciate it if it's a dog. I don't know so much about cats, but get out there and really, as I said, practice what we preach. Try to have some stress relief involved, and really realize that the efforts that we're making are really impactful on the part of our patients. Were it not for our efforts, they would be in potentially much more dire straits. So I think it's really incumbent upon us to be supportive of our patients, but as we said, really take care of ourselves as well.
Well, thank you so much for that. And thank you for everything that you do for our patients at the Diabetes Center. I really, truly appreciate your time. I know how valuable it is. Thank you so much for joining us, Dr. Rodriguez.
You're welcome. You take care now.